Recording in progress.
Okay, guys. So myself, I am Dr. Divya Chaurasya, graduated from Mohs State University in the year of 2021. I have cleared my FMG exam in December 2021 with 222 marks. Today we are here to discuss about post Mahotsav scholarship test 1. The subjects were anatomy, physiology, biochemistry, and microbiology. So today we will discuss all the questions one by one. So the first question is patient presented with headache, vomiting, and altered sensorium. Okay, so they are telling us about headache, projectile vomiting. Okay, then altered mental status. If they have for nuclear also, then the diagnosis directly will be meningitis. Okay, so for meningitis, nuchal rigidity, projectile vomiting, and headache are the symptoms. Okay, here also they have written that we have stained organism with India ink staining. India ink staining means this is a negative stain. Negative stain means those who are having capsule, we can stain their background. But so when we will be staining their background, the capsule will be more prominent. So this is negative staining, or we are also using the stain nigrosin stain or India ink stain. Okay, so here the fungus which is having capsule, that is Cryptococcus. So for Cryptococcus, they will write to any immunocompromised state or patient is HIV/AIDS positive, then they will write you all the signs of meningitis. Then the answer will be Cryptococcus. And also, if they have given you image or any staining, then the short answer will be Cryptococcus meningitis. Second question is smallpox. So for that, you need to remember virus are classified into two types: DNA virus and RN virus. Okay, but here they are asking us about the pox virus. So you just need to remember only one pox virus which will not come under the pox virus, that is chicken pox. Okay, so if you have chicken pox virus, this will comes under the herpes virus. Okay, for this the name is herpes zoster virus. So only pox virus which is not a pox virus, that is chicken pox. So for the smallpox, answer will be pox viridae or pox virus. Next, rubella comes under toga viridae, okay, or toga virus family. Right now, it is also comes under the metonaviridae family. Okay, so you can remember both toga viridae and metonaviridae. For the pox virus, if you have remember, we also have cowpox, molluscum contagiosum virus, and vaccinia, variola. All of these comes under pox virus. Okay, for retrovirus, we have HIV virus and HTLV, which will comes under retrovirus family. For herpes virus, all the human herpes virus plus herpes simplex virus, herpes zoster virus. Now, other than this, you can remember cytomegalovirus and Epstein-Barr virus. These all comes under the herpes virus family. So answer here is pox virus. Next, which virus remains dormant in body and can be reactivated? Okay, for the reactivation, you need to remember the herpes zoster, because this herpes zoster virus will be dormant in ganglions, in body ganglions, trigeminal and all of those ganglions. Whenever patient will face any immunocompromised state, these virus will again activate. So the herpes zoster is answer. Okay, so whenever patient is first time he is suffering with herpes zoster virus, that is called as chicken pox. Okay, but when reactivation occurs, then we are calling this as shingles. Okay, so you need to remember both. So herpes zoster virus, first infection is chicken pox, reactivation is shingles, and this will be dormant in our ganglion, neurological ganglions. Okay, next is RMP is generated by. RMP is resting membrane potential. Okay, in resting membrane potential, you need to remember two things only. First is who is generating and who is maintaining. Okay, for the generation, you need to remember potassium efflux helps in generation of RMP, and for maintenance, you need to remember sodium potassium ATPase pump, which will help us to maintain the resting membrane potential. Okay. For first option, sodium influx, this will help us in generation of action potential, the depolarization phase in the muscles. Okay. For calcium, action potential generation in cardiac tissues or specialized cardiac muscles like SA node and AB node. Okay. Next, fifth question is, which of the following disease has vaccine seroconversion time shorter than incubation time? Vaccine seroconversion means today we have given vaccine and after how much time antibody appears, that is seroconversion time. Okay, so this is a fact that for the rabies, seroconversion time is less than its incubation period. Okay, so answer will be rabies. Next is, a patient is treated with clindamycin for recent infections. Shortly after antibiotic course is completed, he is having diarrhea. What is the likely organism? Okay, so here answer will be Clostridium difficile. Why Clostridium difficile? Because Clostridium difficile causes pseudomembranous enterocolitis. Okay, pseudomembranous enterocolitis. The explanation itself in the word pseudo means false, forming false membrane and causing enterocolitis means the intestinal infection. Okay, so why it occur? Because the most common cause is third generation cephalosporin. Okay, so whenever we are giving long term third generation cephalosporin to any person or any patient or clindamycin, patient is having overgrowth of Clostridium difficile. Okay, what this Clostridium difficile will do, it will form pseudomembrane over these intestinal walls, and also when we will do histopath, we will find volcano eruptions. Okay, so in histopath, the finding will be volcano eruptions, and in the gross, or we can say in endoscopy, it will showing pseudomembrane formation over the intestinal mucous membrane. For the treatment, this is the only oral indication for vancomycin. Otherwise, we are not giving vancomycin orally. Okay, so the drug will be oral vancomycin. Other than this, we can right now we have new drug, that is fidaxomicin. We can also use fidaxomicin for the treatment of Clostridium difficile. Okay, why not EHAC? If you know, EHAC 0157H7 strain is causing hemolytic uremic syndrome. Okay, by the Shiga-like toxin. Shigella is causing dysentery. Okay, by the Shiga-like toxin. For the Bacillus cereus, you need to remember Bacillus cereus is causing acute food poisoning. Okay, within 6 hours, less than 6 hours. And the history will be given: fried rice intake or fried chicken rice intake or anything, fried rice intake, fried Chinese rice intake, fried Chinese rice intake. Okay, and after that, patient is having vomiting or diarrhea, the diagnosis will be Bacillus cereus. Most commonly, the presentation will be acute vomiting after eating fried Chinese rice. Okay, so here the answer will be Clostridium difficile. Next is myasthenia gravis, is a type of hypersensitivity. So that is type 2 hypersensitivity. In myasthenia gravis, we have antibody against acetylcholine receptor. Okay, in postsynaptic terminal. Okay, so whenever we are having any antibody against any receptor, then this will come under type 2. But now we have new classification. All those antibodies which are attacking the receptors which are bound, they will come under type 5 hypersensitivity reaction. So in a hypersensitivity reaction, according to the Gel and Coombs classification, we are having mainly the 4 types. Okay, recently they have discovered the 5th type. In the 4th type, in the first type, the antibody is bound. Okay, and antigen is free. Okay, here antigen is bound and antibodies are free. Here both are making complex. This is cell mediated immunity, and the type 5 is antibodies against the receptors. Okay, in the type 1, if you have remember, all these antibodies are bound to the mast cell and they are doing degranulation of mast cell, more histamine will come. So this here the example mainly will be the allergic reactions. Okay. In type 4, all the granuloma forming disorder will come under this. Okay. In type 3, if you know PAN and SLE, all will rheumatic heart disease, all will come under here. And in the type 2, you have Graves' disease. Okay. And myasthenia gravis, all of those comes under type 2 hypersensitivity reactions. Okay. The question number 8 is, which of the following infection causes severe disease following reinfection? Okay. So whenever person is having one infection, after that he is producing antibody against that. Then if these antibodies are helping other infection to increase or to create more infection, that is called as antibody-dependent enhancement. Okay, we will mainly see this in dengue. What happens in dengue? In dengue, we have 1 to 4 serotypes. Out of this, second one is the dangerous. Okay, suppose somebody has got infection for dengue serotype 1. Okay, they have produced antibody, he has recovered. But the second time he has got infected with the second type of serovirus. Now these antibody will help this second type to create more inflammation. If they will create more inflammation, this is called as antibody-dependent enhancement. So reinfection is more dangerous than the earlier infection, and this is seen under the dengue virus or dengue fever. Next is a person who is on IV drug. Okay, what is the most probable organism? Whenever you will read IV drug abusers, directly you have to mark Staph aureus. Okay, the Staph aureus is most common infection in the IV drug abusers. Okay, whether it is endocarditis or any other infection. But if they will write that there is IV line blockage by biofilm, okay, then you need to remember the this is caused by Staphylococcus epidermiditis. Okay, so these are two different questions. So IV drug abusers, then Staph aureus. If they will ask you IV line is getting blocked by the biofilm, then it is Staph epidermiditis. Or they can also ask you about the SUNS. Okay, the SUN for hydrocephalus. Okay, so they can also be blocked by the Staph epidermidis. Staph saprophyticus you will study under the UTI. This is the second most common cause of UTI in sexually active females. The Staph pyogenes, this is the bacteria which is causing scarlet fever, okay, rheumatic heart disease. This is generally a group A beta hemolytic streptococci. Okay, it is showing the beta hemolytic. Then this agalacti, this you will see in neonatal, or this is causing neonatal meningitis. So these are our main main type of bacteria. So if IV drug abusers, you will mark Staph aureus. If they will ask you IV line blocked by biofilm, then Staph epidermidis. Staph saprophyticus you will study under. This is the second most common cause of UTI in sexually active female. First most common cause will be E. coli. Okay, then Strep pyogenes, this is a bacteria which is causing scarlet fever, rheumatic heart disease, and Strep agalacti, this is causing neonatal meningitis. Okay, so these are our main bacteria. So this is our 10th question. Now next, a patient with the history of 3 days of fever, upper GI pain, they have made the diagnosis of typhoid fever. Now they are asking what test will be performed right now. So for this, for typhoid, you need to remember one mnemonic, that is BASU. Okay, BASU means we will do blood culture in first week. So if any patient will come in 2 days, 5 days history, we will do blood culture. Then we will do antibody test or Bidal test. Okay, for Bidal test, we will do in second week. Then we will do stool culture in third week, and then we can do urine culture in fourth week. So here patient came to us by the 3-day history of fever. So the answer will be blood culture. Next is 28-year-old female patient presented to OPD with diplopia. Neurological examination is showing tingling sensation, numbness in lower extremities, which is worsen on taking hot bath. What will be the diagnosis? So whenever you will listen to these words, na, that worsening of symptom, worsening of either blindness, okay, or diplopia, or sensory symptoms, okay, sensory symptoms after taking hot bath, then the diagnosis will be multiple sclerosis. But if they will ask you that patient is having severe itching after taking hot bath, then the diagnosis will be polycythemia vera. Okay, so here the diagnosis will be multiple sclerosis. So if you know, multiple sclerosis is the problem with oligodendrocyte. Okay, why oligodendrocyte? Because they are forming myelin sheath in the central nervous system. So this is a demyelinating CNS disorder in which they are having demyelination. So the answer will be oligodendrocyte. Okay, so other than this, you will also find Dawson's finger in the MRI. Okay, so why these Dawson's finger? Because of the gliosis around the ventricle. So periventricular Dawson's finger or periventricular gliosis you will find in multiple sclerosis. So answer will be oligodendrocyte. Astrocytes are helping in the formation of blood-brain barrier. Ependymal cells are helping in the CSF formation, and microglia are the macrophages of the brain. Okay, so the answer will be A, oligodendrocytes. Then next question is SCO3 and H2CO3 best buffer due to, because we can, whenever body wants, it can increase or decrease their amount. So answer will be D. Okay, since this H2CO3 is a strong base, so if it is a strong, not be a weak base. Okay, if it is a H2CO3 or HCO3, these are the alkaline, so they cannot be the near of physiological pH, and they cannot donate or accept any H plus. So the answer will be, they can, whenever body wants, they can decrease or increase the concentration of HCO3 and H2CO3. Next is, which of the following pair of sugar are non-reducing? Okay, so we have two types of sugar: reducing, non-reducing. In reducing, okay, we just remember non-reducing, other than everything will be reducing. So in non-reducing, it will be sucrose and 3 halos. Other than this, if you have anything like if you have lactose, maltose, isomaltose, galactose, everything are reducing sugar. So here answer will be C, sucrose and 3 halos. Okay, so the answer will be sucrose and 3 halos. Okay, next is which vitamin is required for the glycogen phosphorylase. Okay, so before going to the answer, we will discuss some of the enzymes which are requiring vitamins. So we will read them here. Okay, so first one is vitamin B1. So if you know, B1 is our thiamine. Okay, so thiamine, which enzymes require thiamine? So the first enzyme is pyruvate dehydrogenase. Okay, if you know, pyruvate dehydrogenase is helping pyruvate to convert it into acetyl CoA. Then alpha ketoglutarate dehydrogenase. This this will come under the TCA cycle. Then transketolase, and next will be pyruvate carboxylase and tryptophan pyrrolase, and also branch chain amino acid dehydrogenase. Okay, so branch chain amino acid dehydrogenase will also come under this. So here we have pyruvate dehydrogenase, we have branch chain keto acid dehydrogenase, okay, alpha ketoglutarate dehydrogenase, transketolase, and pyruvate carboxylase. Okay, suppose somebody will have how we will check this vitamin B1? We will check by RBC transketolase level, we will check, and we will check the level of this enzyme. Okay, then if somebody will have deficiency of B1, what kind of diseases he can have? Or so the first will be beriberi. Beriberi is of two types, dry and wet. In wet beriberi, we have high output cardiac failure. In dry, we are having simply neuropathy. Then next will be Wernicke's Encephalopathies. So Wernicke's encephalopathy will come under when patient is taking only alcohol and he is not taking any diet. Then patient will have B1 deficiency and he is having Wernicke's encephalopathy. If we will not treat this, then patient will end up with having Korsakoff psychosis. Okay, so this will be the same diseases comes under vitamin B1 deficiency. Then we will come to the B2. B2 is riboflavin. Okay, so riboflavin, wherever we are making FAD and FMN, that there we will require vitamin B2. So where we require vitamin B2, the first one will be succinate dehydrogenase. Okay, in the TCA cycle where we are making FAD. Okay, other where we are making FAD is branch chain amino acid dehydrogenase. Okay, then pyruvate dehydrogenase, alpha ketoglutarate dehydrogenase, and other than this in complex 2. Okay, complex 2 of electron transport chain where we are making FAD, we require vitamin B2. Okay, FMN we are making it only one place, that is complex 1 in ETC. So all these places, all these enzymes or all these cycles require vitamin B2. If somebody, what is the marker for this? The marker will be RBC glutathione reductase. Okay, so marker will be RBC glutathione reductase, and if patient will have riboflavinosis or deficiency of B2, then patient will have cheilitis, stomatitis, angular cheilitis. All of those will be the symptoms. Okay, then third one is vitamin B3. Vitamin B3 is niacin. Okay, so wherever we are making NADP, there we are using vitamin B3. Okay, so all the oxidative reductive reactions, they are using vitamin B3. Okay, mainly the dehydrogenase 1 deficiency will lead to pellagra. Okay, and in pellagra, if you know, all 3 Ds will come: diarrhea, dementia, dermatitis, and death. Okay, all Ds will come. Then fifth is pantothenic acid. Okay, so wherever we are using coenzyme A, there we are using vitamin B5. So all the acetylation reactions are using vitamin B5. Deficiency of this vitamin will lead to burning feet syndrome. Okay, and the reaction which are using, we are acetylation reaction. Okay, next is vitamin B6. Vitamin B6 is pyridoxine. Okay, vitamin B6 will be pyridoxine. Okay, pyridoxine. Vitamin B6 is pyridoxine. Okay, so wherever we are using pyridoxal phosphate, there we are using vitamin B6. So the will be all the transaminase reactions like ALT, AST formation, all deamination reaction. Okay, and transsulfation, simple decarboxylation, cysteine synthesis, and in the question we have glycogen phosphorylase. All of these things are using vitamin B6, and by the deficiency of vitamin B6, we are having anemia. Patient can have anemia with neurological symptoms, and in infants we can have seizure. If these seizures are refractile, we are giving vitamin B6. Okay, so pyridoxal sulfate. Vitamin B7 is biotin. Okay, so all the carboxylation reactions are using vitamin B7. Okay, and the deficiency, by the deficiency of this, patient will have multiple carboxylase deficiency. Okay, and I said all the carboxylation reactions are using vitamin B7, but here we have some exception. Like first exception is CPS, carbamyl phosphate synthetase 1 and 2 will not use. Second is malic enzyme will not use vitamin B7. Third is carbon number 6 in purine synthesis will not use vitamin B7, and gamma carboxylation of clotting factor where we have required vitamin K, that also will not use our biotin enzyme. Okay, now vitamin B9 is folate. Okay, or Wherever we are producing tetrahydrofolate, we are requiring vitamin B9. Okay, so all the carboxylation reactions and thymidylate synthase, okay, which is used in pyrimidine synthesis and enzymes in purine synthesis, and deficiency will lead to megaloblastic anemia. Okay, and in pregnant lady, if there will be deficiency of B9 or folate, then the baby will have neural tube defects. Okay, like neural tube defects, like he's having anencephaly or meningitis, all of those things baby will have. Then vitamin B9 will be cobalamin. Okay, so by the deficient, where we have required vitamin B12, we want to change homocysteine to methionine. Okay, so the enzyme used here, it is using vitamin B12. So suppose somebody is having deficiency of this, then patient will have less methionine, more homocysteine. Then this more homocysteine will lead to accelerated atherosclerosis. Okay, so here is the first place. Second place, for the conversion of methyl malonyl CoA into succinyl CoA. This succinyl CoA is used for the synthesis of myelin sheath. Okay, so somebody is having deficiency of vitamin B12, then this step will not occur. Patient will have deficiency of succinyl CoA. More methyl malonyl CoA will accumulate, so patient will have subacute combined degeneration, the degeneration of the spinal cord tract. Okay, or the neurological symptoms in the vitamin B12 deficiency. Other than this, these are also required for the methylation reaction in pyrimidine synthesis. Okay, pyrimidine synthesis. So if they will not occur, then there will be no nuclear maturation. If nucleus will not mature, RBC will be megaloblastic. Okay, or there will be megaloblastic anemia. There will be nuclear cytoplasmic asynchrony, which will lead to megaloblastic anemia with the hypertrophic, hypersegmented neutrophil. Why? Because it will affect all the cells. Okay, so if RBCs are affected, patient is having anemia. WBCs are affected, so the patient will have hypersegmented neutrophils. Okay, vitamin C, that is ascorbic acid. Okay, so ascorbic acid required mainly in all the hydroxylations reaction. Okay, whether it is bile acid synthesis or it is tryptophan synthesis or it is collagen synthesis, everywhere vitamin C is required. Deficiency will lead to scurvy, so bleeding from the gums, all of those things will come under. So here, which vitamin will require glycogen phosphorylase? The answer will be vitamin B6. For B1, you can also remember a mnemonic BF. Okay, so for BF, by the B, we are having branch chain keto acid dehydrogenase. Okay, branch chain keto acid dehydrogenase. Okay, from the A, you can remember alpha ketoglutarate dehydrogenase. From the P, you can remember pyruvate dehydrogenase, and from the T, you can remember trans ketolase. Okay, for succinate dehydrogenase, we require B2. Okay, for oxidation reduction reaction, we require vitamin B3. For acetylation reaction, B5. Transamination, deamination, and glycogen phosphorylase, we require B6. Carboxylation reaction, B7. And for the carboxylation and thymidylate synthesis in pyrimidine synthesis, we require B9, and all of B12 we require for the homocysteine to convert into methionine, methyl malonyl CoA to succinyl CoA, and methylation of pyrimidine. Okay, and for hydroxylation we require vitamin C. Okay, so here answer will be vitamin B6. Next question is, only anaerobic glycolysis occurs except. So where we see anaerobic glycolysis, where mitochondria is absent. So lens don't have mitochondria, cornea don't have, RBC don't have. So answer will be CNS. All these places other than CNS will have anaerobic glycolysis. Okay. Next is, which of the following enzyme is not involved in fasting? Okay. So for the fasting, you need to remember that in the fasting you are, like I will tell you one concept. In the fed state, when you have more glucose. In the fasting state, when you have less glucose. When you have more glucose, insulin will be more. So the more dominant hormone will be insulin. For the fasting, all other hormone mainly will be the glucagon. Other than you can also have increased level of cortisol. Okay, or steroid hormones. Okay, so this insulin will make or take all the glucose to form other things like anabolic. All the anabolic reaction will be more active here. Okay. So this in fed state, we have more predominantly anabolic reaction, means glucose is utilized to form amino acid, fatty acid, all of those. In the fasting, more glucagon. So here you are having catabolic pathways are active. So more catabolic pathways are active, more destruction, means more glucose is forming. Here we are utilizing glucose, here we are forming glucose. Okay. So here the reactions which are more dominant in fat stage will be fatty acid synthesis. Okay, so we are synthesizing fatty acid from glucose, cholesterol synthesis, okay, protein synthesis, okay, and glycogen synthesis. So all the synthesis reaction will come here. In catabolic pathway, you will have all the degradation. So fatty acid oxidation, by the fatty acid oxidation, we will form acetyl-CoA, then we will produce ATP. Glycogenolysis means the breakdown of glycogen. Gluconeogenesis means we are forming glucose from other substrates. Ketone body synthesis and oxidation both will come under the catabolic pathway. Okay. Other than, you have to remember, in the fed stage, all the enzymes are activated or stimulated in the form of dephosphorylation. So whenever we are doing dephosphorylation of enzymes, they will be activated in fed state. Whatever enzyme activating here, they are activated by the phosphorylation. Okay. So by the phosphorylation, we can activate all enzymes in the fasting state. We can activate all our enzymes in the dephosphorylation phase in the fed state. Okay. Only catabolic reaction, okay, which is comes here, only catabolic pathway which will comes under here is glycolysis. Okay. So this is the exception. Okay. Other than this, here we have more level of LPL. Okay. Lipoprotein lipase more in the fat state. Human hormone sensitive lipase is active in the fasting stage. So you have to remember, fasting stage, HSL, hormone sensitive lipase is activated, glucagon, cortisol are more, all the catabolic pathways are working. For the fat stage, insulin is more, lipoprotein lipase is more, anabolic pathways are going on, only catabolic which will be activated in fat state, that will be glycolysis. So here they are asking you not elevated in fasting, means which are not activated in fasting. So hormone sensitive lipase is activated in fasting. Glycogen phosphorylase means glycogen breakdown is also activated in fasting. Okay. CPS, this carbamyl phosphate synthetase 1, this is producing, it is using ammonia plus carbon dioxide and producing urea. Okay. So this comes under amphibolic pathway. Whenever this will mostly comes under the amphibolic pathway, it can be anabolic, it can be catabolic. So here the most probable answer will be acetyl-CoA carboxylase. Okay. What acetyl-CoA carboxylase will do? It will utilize, or it will take acetyl-CoA and convert it into malonyl-CoA. Okay, this malonyl-CoA will go into the fatty acid synthesis. So this will mainly active in the fat state, because we are synthesizing fatty acid in the fat state. So answer will be acetyl-CoA carboxylase. Question number 17. In starvation, thyroid hormone changes don't include. So if you know, in starvation we are not taking anything, so we are not having enough amount of iodine. If we don't have enough amount of iodine, the total T4 will be less. Okay, so this is true statement. Total T3 will be less, because T4 is the inactive form, T3 is the active form of T4. Okay, so whenever thyroid hormone wants to work, it will convert into T3 and work. So here this will also be less. Then free T3 will also be less, because we are not having more protein. So all these three statements are true. This statement is wrong. Why? Because in starvation we want to save more energy. If body wants to save more energy, then we need to reduce our BMR, basal metabolic rate. So suppose if body will convert this T3 to T4 to T3, this T3 will be active and it will increase our basal metabolic rate. But in starvation, this T4 converting into reverse T3 and this is inactive form, this will not work. So in starvation, we will have more amount of reverse T3. The enzyme used here is 3,5-triiodothyronine. Okay, so why this enzyme? T4 in the starvation condition convert into reverse T3, which is an inactive form, and then cycle will not occur. So our BMR will not raise and patient will save energy. So here answer will be decrease in reverse T3 because we want to answer the wrong statement. Okay, so don't include means decrease total R3. If they have written here increase, then the answer will be this also will be the true statement. Okay, so the decreased total R3 is wrong. In starvation, okay, we have decreased total T4, decreased total T3, decrease free T4 and T3, and increase reverse T3. Okay, so all of these will be the parameters in this starvation. Okay, next is thiamine is cofactor for all of the following enzymes except, okay, thiamine is B1. I told you, remember, B act. B for branch chain keto acid dehydrogenase, it use alpha ketoglutarate dehydrogenase, it use vitamin B1. Pyruvate dehydrogenase, it will use B1, and transketolase will also use B1. So here answer will be succinate dehydrogenase, which is using vitamin B2. Okay, so here answer will be C. Next is which enzyme require vitamin C synthesis in missing in humans? So this is a fact. We don't have L-gluconolactone oxidase, so that's why we cannot synthesize vitamin C inside the body. Which vitamins helps in the absorption of iron? So for the absorption of iron, you need to remember two things. Okay, whenever we are having acidic pH, okay, or pH is low, or any acid, ascorbic acid, citric acid, these all will increase the absorption of iron from the intestine. Okay, then if somebody is having more alkaline pH or pH is more, he is taking antacids or proton pump inhibitor, which are not allowing acid to release, or tannates, phytates, all these things will decrease the absorption of iron from the intestine. Okay, tannates, phytates like tea, coffee, all these vegetarian, all of those things, vegetables, they will decrease the absorption of iron. So here answer will be vitamin C. Next is found out the value of LDL when total cholesterol is 300 mg per deciliter, HDL is 25 mg per deciliter, and triglyceride is 150. To calculate LDL, we have one formula, that is total cholesterol minus HDL minus triglyceride divided by 5. Okay, so here total cholesterol is 300 minus 25 minus 150 upon 5, so it will be 30. Okay, so 30, 25 will be 45, 55. So answer will be 245. Okay, so here answer will be 245. So this is the formula to calculate the LDL. What are the omega 6 fatty acids except? Okay, so you need to know what are the omega concept. Okay, so whichever end is having methyl group, we will start labeling as omega 1. Okay, if they are having carboxyl group, they are alpha. If they are carbon attached to the alpha carbon, then that will be beta, and carbon to the beta carbon will be gamma. Okay, so here we need to remember some omega 6 and omega 3 fatty acids. Okay, so what comes under the omega 6? One is linoleic acid, other one will be arachidonic acid. Okay, then next will be docosahexaenoic pentanoic acid and gamma linolenic acid. Okay, so all these are omega 6. What are omega 3? Omega 3 will be alpha linolenic acid, okay, icosapentanoic acid and docosahexaenoic acid. All these comes under the omega-3. So here omega-6 except means we want to identify the wrong one. So linoleic is omega-6, gamma is omega-6, arachidonic is omega-6. So here answer will be alpha linolenic acid. Okay, so here the answer is alpha linolenic acid. Next is saturine gout caused due to lead poison. In chronic lead poison, we are having saturine gout. All of the following enzyme deficiency give rise to hyperuricemia except. Okay, so we want to know what are the enzymes causing hyperuricemia. For that, we have to learn about few cycles. So first is here. So somebody is having more AMP. This more AMP will convert into adenosine. By the adenosine deaminase, it will convert into inosine. Inosine will convert into hypoxanthine. By the use of xanthine oxidase, hypoxanthine will convert into xanthine, and this xanthine will get converted into uric acid. Okay, so in the first option, they have mentioned xanthine oxidase. So suppose somebody will not have this xanthine oxidase. Okay, they have deficiency of xanthine oxidase. Then hypoxanthine will not get converted to xanthine. Xanthine will not convert into uric acid. Okay, so means somebody will have xanthine oxidase deficiency means they will have decreased uric acid level. Okay, so the same is question asking that all of the following enzyme deficiency give rise to hyperuricemia, more uric acid. Okay, except means the wrong statement. So answer will be xanthine oxidase. Okay, so here we have got to the answer that xanthine oxidase, because xanthine oxidase is required to convert hypoxanthine and xanthine to uric acid. Okay, so somebody will don't have xanthine oxidase, then they will not form uric acid, so they will have hypouricemia. How other option glucose 6-phosphatase is causing? So here you can see the another cycle that glycogen getting converted into glucose 6-phosphatase. Okay, so here we are studying glycogenolysis, breakdown of glycogen. So this glucose 6-phosphatase, why the use of glucose 6-phosphatase converted into glucose. Okay, somebody is having deficiency of glucose 6-phosphatase, then this glucose 6-phosphate will not convert into glucose. Then they have more 6-phosphate, then this will form more fructose 6-phosphate, then more fructose 1,6-phosphate, and they are continuously using ATP. So they are using ATP, these ATP will convert into ADP. More ADP are forming, they will form more AMP, then they will form more inosine, more hypoxanthine, more xanthine, and then ultimately they will cause hyperuricemia. Okay, so what is this enzyme deficiency called as? So glucose 6-phosphatase deficiency will be called as von Guericke disease. Okay, so von Guericke disease is a glycogen storage disorder, okay, in which we are also having hyperuricemia. Other than this, you can also read about that fatty doll-like faces, all of those things, hepatosplenomegaly, all of those things you will also see in von Guericke disease. How HGPRTs will cause hyperuricemia? So for this, you have to remember this cycle, that whenever we are having inosine, this inosine will convert into xanthine. Then this xanthine, by the help of PRPP in the presence of HGPRTs, will convert into IMP. Means we are again reutilizing our breakdown products of AMP and ATPs. Okay. Suppose somebody will not have this HGPRTs, then they will not form this IMP, and all the hypoxanthine will accumulate and it will go and form xanthine, and they will form uric acid. So this will also lead to hyperuricemia. Okay, next is aldolase B. For the aldolase B, you need to remember that fructose in the presence of fructose kinase will form fructose 1-phosphate. This fructose 1-phosphate or fructose 1-phosphatase or the enzyme is aldolase B will convert this into glyceraldehyde and dihydroxyacetone. If somebody will not have this aldolase, then they will have more fructose 1-phosphate formation. This is the stimulator, so it will again form more and more, and they will use ATP, so they are forming more IMP and more uric acid. So by this, all of these enzymes will form will cause hyperuricemia. Okay, other than this, which enzyme will cause this condition? So hyperuricemia can be caused by many enzymes. Okay, so for hyperuricemia, you need to remember there are some primary causes. some secondary causes. For the primary causes, you need to remember HGPR deficiency. Okay. Other than this, you need to remember PP synthetase deficiency, means if we are not able to produce PRPP, how we will utilize. Okay. And PRPP, amino transferase deficiency. Amino transferase deficiency. Okay. For the secondary, you can remember glucose 6-phosphatase deficiency, okay, and aldolase B deficiency. Other than this, we are also having so many, but these are the main enzymes you can remember. Okay, so these all enzymes deficiency will cause hyperuricemia except xanthine oxidase, because we require xanthine oxidase to produce uric acid. If we don't have xanthine oxidase, there will be no less level of uric acid. So the answer will be A. Next is, which of the following examples of irreversible suicidal inhibitor accept? So for that, you need to remember that we have two types of inhibitors. Okay, one is reversible, other is irreversible. In the reversible, we have competitive, uncompetitive, and non-competitive. Okay, for the irreversible, mainly you will remember the suicidal inhibitors. Okay, in the suicidal inhibitors, what does it mean, suicidal inhibitor? Suppose I have given one drug. Suppose I will take example of allopurinol. Okay, this allopurinol, by the help of enzyme xanthine oxidase, will convert into oxopurinol. Okay, this oxopurinol will go and inhibit xanthine oxidase, means they are blocking the same enzyme which are converting them into the active form, means the product will inhibit the enzyme which is producing more product. So this is suicidal inhibition for xanthine oxidase. Okay, so for the allopurinol, xanthine oxidase is a suicidal inhibitor. Then next is penicillin for glycopeptide transpeptidase is a suicidal inhibitor. For 5-fluorouracil is also a suicidal inhibitor for thymidylate synthetase. This malonate to succinate dehydrogenase, this is a competitive inhibitor for succinate dehydrogenase. Okay, so this is a competitive inhibitor. Other than this, you can remember aspirinol, COX-A, all of those things are our suicidal inhibitors. Okay, so here answer is option number C. Next is a patient admitted to the ICU by the acute myocardial infarction. He suffered the second attack on the 4th day. How to confirm the diagnosis? Diagnosis will be confirmed by the serial values of troponin T and I. Okay, so for the reinfarction, we are continuously monitoring the troponin T and I levels. If they elevated more than 20%, means that confirm the diagnosis of reinfarction or the again attack has came. So here the answer will be serial value of troponin T and I. Okay, spot diagnosis just tell us that okay, he is having MI or not. CPKMB values, we can also find them in the muscle injury. So how we will confirm? So this is a very non-specific. LDH ratio flipping, they will also tell us only once. Okay, and also LDH we will find in other problems, like somebody is having hemolytic anemia or there will be hemolysis. So then also that LDH levels are raised, so we cannot confirm the diagnosis by this. So we will mainly confirm by the serial values of troponin T and troponin I. The next is, okay, so next is in the last line they are asking which organ do hepatitis B and C will affect. So they are also saying hepatitis means liver, so hepatitis will affect the liver. Very easy question. Then next is maternal antibodies don't provide protective immunity against. Okay, so for this you need to remember, this is also a factual question, that maternal antibodies don't provide immunity against the polio. So they can protect baby against few like diphtheria, pertussis, tetanus, measles, and rubella, but they don't protect against polio, okay, Japanese encephalitis, and hepatitis A. So you need to remember they will not protect baby against polio, Japanese encephalitis, and hepatitis A. Other than this, they can protect against diphtheria, pertussis, tetanus, measles, and rubella. Until maternal antibodies are present inside the baby, they can protect him against these Next is, which of the following is most likely to be acquired by the traumatic inoculation? Okay, traumatic inoculation means injury. So the most definitive answer is sporothrix sankey, because it is also called as rose gardener's disease. Okay, and rose gardener's disease is mainly by the thorn prick of rose. Okay, so thorn prick by the rose, or the garden, thorn prick of the gardener. Okay, so this will cause the sporothrix sankey. Okay, so this is mainly inoculated by the trauma. Other can also come in the body by the inhalation route. So this will be answer. Sporothrix sankey will be the answer. Which of the following vector for the Zika virus? So Zika virus is vector is Aedes aegypti. What other disease Aedes can transmit? So Aedes can transmit Borneo virus. It can transmit chikungunya virus. It can transmit Rift Valley fever. Okay, it can transmit yellow fever and dengue. Okay, and our Zika virus. Then second option is Culex. So what is the what diseases having Culex as a vector? The Culex is transmitting. Culex will transmit West Nile fever, Japanese encephalitis, filariasis. In the filariasis, which one? Wucheria Bancrofti one. Okay, and Western equine encephalitis. Okay, all of these diseases having vector of Culex. Okay, so the vector for all of these diseases Culex. Then Anopheles, if you know, female Anopheles will transmit malaria. This Phlebotomus pepatacea is a sandfly, and this is the main vector for the Kala Azar or Leishmaniasis. Okay, other than this, it can also transmit Oraya fever. Oraya fever is caused by Bartonella bacilliformis. So these are all the vectors for the major diseases. Next is, during the cardiac cycle, opening of aortic valve takes place at. Okay, so here is, this is our pressure volume loop. Okay, so in cardiac cycle, how we will, at which time we have maximum pressure and which time we have maximum volume, we are, so cycle mostly starts at the atrial systole. Okay, atrial systole, or you can say last rapid filling. After last rapid filling, we are having systole starting. Okay, so this is the last stage of diastole. After diastole, we are having the starting of systole. So in the starting of systole, atrial valves closes. Okay, AV valves close it. Okay, atrioventricular valves are closing. When AV valves are closing, AV valves are closed and semilunar valves are closed, then at that time atria and ventricles are contracting, ventricles are contracting. This is called as isovolumetric contraction. Isovolumetric contraction means at the same volume the pressure inside the ventricles are rising, that is isovolumetric contraction. At the end of isovolumetric contraction, aortic valves or semilunar valves are opening. Then this is our rapid ejection. This is our slow ejection. After slow ejection, here this is the end of systole or starting of diastole, that is protodiastole. At this stage, all the semilunar valves are closing, and here right now here all valves are closed. Now ventricles are relaxing at the same volume. So this is isovolumetric relaxation. At the end of isovolumetric relaxation, AB valves are opening, then ventricular filling is occurring. So rapid filling, first phase of rapid filling, then slow filling, then last phase of rapid filling, and this slow filling is also called as diastasis. Okay, so in diastasis the heart is moving very less. So at this time we are also having very less movement of ventricular valve. So here you can see they are asking about the opening of aortic valve. So if you can see in this diagram, opening of aortic valve will occur at the end of isovolumetric contraction. So answer will be end of isovolumetric contraction. Okay, end of isovolumetric relaxation, what will happen? So here AB valve will open. Okay, beginning of isovolumetric contraction, what will happen? So AB wall will be closing. Okay, and beginning of isovolumetric relaxation, what will be happening? Aortic walls are closing. Okay, so here are all the events in cardiac cycle where we are having which valve closure, and these closing of mitral valve will produce S1 heart sound, closing of aortic valve produce S2 heart sound, S3 heart sound will come in the rapid filling phase, and S4 by the atrial systole. Okay, so when atria will contract, we will have S4 heart sound. Next is, or at the end of isovolumetric relaxation phase, what will happen? Okay, so in the end of isovolumetric relaxation phase, our AB valve will open. So here you can see at the end of isovolumetric relaxation, mitral valves are opening. So answer will be at AB valves are opening. Okay. During the cardiac imaging phase of minimum motion of heart, means this will occur in diastasis, and diastasis will be occurring in mid diastole. During the diastole phase, in the middle we will have. Why not in the late diastole? Because here we are also having atrial systole. If atria are contracting, means there will be more movement. So here we have very less movement. So for cardiac cycle, you need to remember few things. Okay, so cardiac cycle is 0.8 second. This will be for ventricle and atria. For ventricle, systole will be 0.3, diastole will be 0.5. For atria, systole will be 0.1 and diastole will be 0.7 second. For the phases, diastole will have first phase protodiastole, second isovolumetric relaxation, fast rapid filling, slow filling or diastasis. Then third will be last rapid filling. Okay. For first rapid filling, you need to remember most of the filling is passive. Okay, in diastasis we have minimum wall movement, and in the last rapid filling, or this is also atrial systole, at this time atria are in contraction phase, so this is the active filling phase. For systole, you have first phase is isovolumetric contraction, means at the same volume ventricles are contracting, then rapid ejection, then slow ejection. Okay, all the walls I have told you when they are closing. Okay, and when will be the minimum ventricular pressure you will see? Minimum ventricular pressure you will see at the end of isovolumetric relaxation phase. Okay, so inside the ventricle you have minimum pressure in isovolumetric relaxation phase, and okay, and you know first heart sound will come by the closure of AB valve, second by the closure of semilunar valve or aortic valve, third in the fast rapid filling phase, fourth will be in last rapid filling phase, that will be by the actual contraction. Okay, and all of these are important things related to cardiac cycle. Which one of the following correlates with isovolumetric contraction phase? Okay, so I told you in isovolumetric contraction means we are keeping volume as constant. Okay, volume is constant, only pressure is increasing. Okay, so here you can see if we will close both the valves, then only we can keep the pressure constant inside the ventricle. So here both the valves will be closed, either it is in the starting of IBC or in the starting of isovolumetric relaxation. So if we want to keep the pressure constant, then we need to close all the valves. If all valves are closed, no blood is moving here and there, then only we will have isovolumetric contraction or relaxation phase. Next is, which of the following is true about fourth heart sound? So fourth heart sound, this will come by the atrial systole. Okay, so this will hurt during the ventricular filling, or if specifically then last rapid filling phase. Okay, so this will come in the ventricular filling phase. Pepsinogen is secreted by, so pepsinogen, if you know, in stomach you have few cells. Okay, first is surface mucus cell, then mucus neck cell, then you have parietal cell or oxyntic cells, then you have chief cells or zymogen granules, and endocrine cells. Okay, in smooth surface mucus neck cell, they are producing alkaline mucus. Okay, this surface mucus cells are mucus neck cells are producing acidic mucus. These parietal oxyntic cells are producing HCl along with their intrinsic factor of Kessel. Chief cells are producing pepsinogen. Okay, and these endocrine cells are producing gastrin and other hormones. So pepsinogen is produced by G cell, parietal and oxyntic cells are same, mucus cell will produce mucus. So you can also rule out this option and you can get the answer. Which of the following enzyme is stable in acidic pH? So if you don't know anything about this question, you just need to remember acidic pH in stomach. So in stomach, we are having pepsin. Okay. Even if you don't know where pepsin is present, then also you can remember trypsin, chymotrypsin, and carboxypeptidase. All these three are pancreatic enzymes. So if they came from the pancreas, means these are not stable at acidic pH. So pepsin will be stable at the acidic pH. Which of the following condition present with absence of both Mullerian duct and Wolffian duct structure? So what happened in universal, if you remember, the gender of fetus will be female. Okay, only when there will be Y chromosome present or in the zygote, then only they will have formation of male. Okay, so this Y chromosome is having SRY gene. Okay, this gene helps in the formation of testis. So by this gene, testis will form. Then testis will have two cells. One will be Leydig cells, other will be Sertoli cells. Okay, these Leydig cells are producing testosterone, or I can say androgen, and Sertoli cells are producing Mullerian inhibitory hormone or Mullerian inhibitory substance. Okay, this Mullerian inhibitory substance, if you know, in female, all the genital tracts are derived from the Mullerian duct or paramesonephric duct. All the male genitalia, they are derived from the Wolffian duct, okay, or Wolffian duct, or they can be mesonephric duct. Okay, so this Mullerian inhibitory substance will go and inhibit Mullerian duct. So if they will inhibit Mullerian duct, female genitalia will not form. Okay, then this testosterone will also go and stimulate. Okay, this testosterone and androgen will also go and stimulate the formation of male genitalia. But suppose they are working on the receptor, these receptors are not able, or these receptors are not good, these receptors have some defect, this testosterone will not be able to work, then patient will also don't have any male genitalia. So the question is asking condition where absence of both male genitalia, means the Mullerian duct and derivative means the female characteristic, and Wolffian duct means male characteristic. So absence of both will be seen in androgen insensitivity. Why? Because testis has formed. It has secreted Mullerian inhibitory substance which has inhibited Mullerian duct. So now female genitalia will not form. Testosterone is forming. Fetus is having more testosterone. Still, the receptor is having this defect, or the receptors are not working properly. So this testosterone will not be able to work. So there will be no development of Wolffian duct derivative. So the answer will be androgen insensitivity syndrome. Other option is the first option is anti-Mullerian hormone deficiency. If somebody don't have any anti-Mullerian hormone, then the characteristic will be female, so that child will be female. FSH receptor don't have any effect. Ovotesticular means patient is having ovary plus testis, that is ovotesticular syndrome. So the answer here will be androgen insensitivity syndrome. Next question is 7-year-old boy presented to OPD. His mother stated that he is having difficulty in rising from the floor and also having calves are hypertrophied. What defect is deficient? So when the child is not able to get up from the floor and he is using his own body to get up, this is called as Gawar sign. Okay, so Gawar sign is mainly seen in the Duchenne muscular dystrophy. Okay, what happened in Duchenne muscular dystrophy? There will be defect in the dystrophin protein. Okay, so this sarcolemmal protein is defected, so muscles are not good. Okay, why they are having calves hypertrophy? Because their thigh muscles got atrophied. If thigh muscle go in atrophy, the calf muscle looks like hypertrophy. Okay, so this hypertrophy is not true hypertrophy. This is a pseudo hypertrophy of calf muscle, and patient is having problem with getting up, and patient may die until 10 to 12 years of age because of severe cardiac defect. So the answer will be dystrophin protein. Where we will study dynin we will study in Carter-Jenner syndrome. Okay, in Carter-Jenner syndrome there will be cilia defect because in cilia we have dynin protein. Okay, laminin you will study in LMNA defect. Okay, this you will study in progeria. Okay, the progeria, if you have seen the palm movie, Amitabh Bachchan is getting old in very early age, that is Hutchinson-Gilford syndrome. Okay, this laminin protein is used in the formation of nuclear lamina. So if this is defected, then nuclear lamina will not form properly. Then patient will have Hutchinson-Gilford syndrome or progeria. Means in the childhood only he is start getting old. Okay, so this is Hutchinson-Gilford syndrome, LMNA defect because of laminin protein. Next is substance and the type of transporter across the membrane. Choose the incorrect combination. For this, you need to remember we have few type of transport. Okay, so the first type of we have transport is this membrane transport is divided into two. Active means they are using the ATPs. Passive means simply by the diffusion or osmosis. Inactive we have two types: primary active, secondary active. Primary active, wherever they are, you will read ATPase. These all are primary active. Okay, so here you have to remember sodium potassium ATPase means they are having their own ATPase enzyme. They are breaking down the ATP and utilizing. Other than this, hydrogen ATPase or the proton pump. Other than this, calcium ATPase. Okay, secondary active, they are again get divided into two types. Okay, the first type is co or symport, and other will be counter or antipode. Means these two molecules are moving same side or these molecules are moving opposite direction. Okay, secondary means they don't have ATPase enzyme, still they are using ATP by the primary pump. Okay, so when they will produce, they will degrade the ATP. Some ATP are also utilized by the secondary active. In co-transport or symport, you have SGLT, sodium glucose transporter 1 and 2, and sodium potassium 2 chloride, and also you have sodium iodine symporter. Okay, so all of these will be the example of co-transport or here you will study sodium calcium exchanger and also chloride HCO3 exchanger. So all of these are exchanger, mainly comes under the counter. In the passive you will mainly mainly study the diffusion. Okay, this diffusion is of two types. Okay, the diffusion is of two types: simple diffusion, facilitated diffusion. Simple diffusion means no carrier protein, simply they can diffuse. So all the gases at the alveoli level, they will do simple diffusion. In facilitated, they require carrier protein. If they require carrier protein, means saturation most probably will occur in the facilitated diffusion. For the facilitated, you need to remember glucose transporters and aquaporin. All of these are our facilitated transfusion. Now we will go to the options. So first, oxygen is simple diffusion, yes, because this is a gas. Glucose by the facilitated, yes, glucose transporters, I told you. Sodium potassium 2 chloride, second reactive, yes, because this is a symporter. Aquaporin, primary active, no, because this don't have ATP, so answer will be aquaporin or primary active transporter, because aquaporin is a facilitated diffusion example. Next is plastic petri dishes are sterilized by. Okay, so plastic petri dishes sterilized by. If in general you remember that all the petri dishes, okay, if they didn't mention means they are asking about the glasses. They are mainly sterilized by hot air oven. Okay, but this plastic dishes are sterilized by the ethylene oxide. Okay, other than this, you need to remember few temperatures also. So for the temperatures, you need to remember like hot air ovens temperature, and other than this, you need to remember the autoclave temperature. What are the dishes sterilized by them? All of these things you need to remember. Okay, so for all the glassware, cotton swab, bags, oil, liquid paraffin, all of those things are sterilized by hot air oven. What is the temperature for hot air oven? This will be 160 degree for 2 hours. Okay. And biological or the control for a hot air oven will be Clostridium tetani, spores of Clostridium tetani or Bacillus subtilis. Okay, so this will be the control for this. Then next will be autoclave. So for the autoclave, you need to remember two temperature. One is 121 degrees Celsius for 15 minutes, 15 psi, which we are generally using. But if you want to kill the prions, then we have to increase the temperature to 130 degrees, 134 degrees Celsius to 1 and 1.5 hour at 15 psi. Then they will kill the prions, the abnormally folded protein. Control for this will be geobacillus. Okay, and where we can use autoclave, all the instruments, okay, and aprons, and you can use for sutures, except you need to remember the catgut suture, which we will sterilize by or disinfect by the radiation. Okay, we will do by the radiation. Then you need to remember all the culture media except Lowenstein Johnson and Loeffler serum slope. These two will be sterilized by the insipidization because they are containing eggs. If we will sterilize these media on the egg, then egg will coagulate and also sputum. All of these things are sterilized by autoclave. Okay. Other than this, you need to remember where we will sterilize all the heat sensitive vaccines. Okay. So for the heat sensitive vaccines or heat sensitive stuff, antibiotics, serum, or all of those toxins, we will use filtration. Okay. And the control for filtration will be Bacillus diminuta. Okay. Then here also in option they have given glutaraldehyde. Okay, so for the glutaraldehyde, you need to remember this is also called as side deck. And all these scopes, whatever scopes we are having, we are sterilizing by the glutaraldehyde, except you need to remember arthroscope and urethroscope. Okay, they are sterilized by, both of these are sterilized by plasma sterilization. Okay. Then we have Lysol, which is a simple phenol. We are using this for our SAT instrument. Okay. We can also use hydrogen peroxide. This is a Suicidal. It can also kill the spores. You can also use ethylene oxide, which we have example. So ethylene oxide is used for cardiopulmonary machines. Okay. You can use it for all the pre-packed syringes. Okay. And plastic petri dish. Okay, and the control for this, control for ethylene dioxide, ethylene oxide will be Bacillus globuli. Okay, so here answer will be our ethylene oxide. Okay, hydrogen peroxide is Suicidal, Lysol is our simple phenol, and glutaraldehyde, that is Sidex, we will use for all these scopes. So here full sterilization almost completed. Next is what is the which ligament prevent the spleen downward displacement? So answer will be phrenocholic ligament. The phrenocholic ligament means colon is attached to the diaphragm. Okay, linorenal means spleen attached to the renal. So if we will attach spleen to the renal or kidney is below, so it can pull. No relation with upper pole, no relation with the sigmoid colon. Next is renal angle lies at. So here you can see this is our renal angle. So this is our 12th rib. This is the lateral border of erector spinae or sacrospinalis. So the answer will be A, 12th rib and lateral border of sacrospinalis. Next is ureter are identified during the surgery. They are identified by their peristalsis movement. Okay. So whenever during the surgery we want to identify the ureter, it will be identified by this movement. Okay. It don't have any rich arterial plexus. It don't have any relation to the renal artery and vein. It don't have any relation to the lumbar plexus. Here you can see this is our right side This is our left side. You can see this is the ureter. Okay, so ureter is related to, you can see this is our gonadal vessel. This is our right colic vessel. This is ileocolic vessel, and this is root of mesentery. So other than this question, you need to remember right or left relation of the ureter. Okay, so right side it is related to right colic vessel, ileocolic vessel, right gonadal vessel, root of mesentery. Left side it is related to left colic vessel. Okay, sigmoid vessels, left gonadal vessels, and sigmoid vesical colon. You need to remember because nowadays there are more questions on the relation. So here answer will be peristalsis movement by the due to flow of urine. Next is what are the anterior relation of right kidney? Except. So for that you need to remember what structure we are having right side, what structure we are having left side. So right side we are having liver. Okay. Left side we are having stomach, so gastric and spleen. Okay. So here you can see the uppermost part of the kidney is having a gland, suprarenal gland, which will be present on the both sides. Then the area on the right side majorly covered by the hepatic. Okay, the liver. So here liver will be present anteriorly. Then below that we have colic area. This colic area is having mainly the hepatic flexure. Okay, the connection between the transverse and ascending colon. So this is hepatic flexure area, and this is duodenal area. In the near the midline, they are having related to the duodenum. Which part of the duodenum? Mainly the third part of the duodenum, or second part of the duodenum. Okay, so second part of the duodenum is mainly related to the this area. Okay, why not third part? Because third part is horizontal part. So how it can be related to the kidney? Okay, on the left side, upper part is having suprarenal gland. Then we have stomach area, spleen area, pancreas on the left side, colic area and duodenal areas. Okay, so here if we will read the option, suprarenal gland both sides, hepatic flexure right side. Okay, liver right side. Third part of duodenum will be the answer because it is asking about the exception. So answer will be third part of the duodenum. What is the narrowest part of the ureter? So answer directly will be urethrovesical junction. When ureter are entering into the bladder near the trigone, they are the narrowest. The neck of pancreas related to in on the posterior surface. So here you can see this is pancreas, this is head of pancreas, uncinate process, neck, body, tail. So in the neck, posteriorly we have aorta, we have splenic vein, we have superior mesenteric vein, and this is our superior mesenteric artery. So posteriorly, the pancreas is having neck of pancreas is related to part of aorta, and splenic vein, superior mesenteric artery. So answer will be superior mesenteric vein. It is not related to gastroduodenal because it will hear something near the head. Inferior vena cava is behind the head. Bile duct is also near the head. So answer will be superior mesenteric vein. Which of the following structure found in the cross section of thoracic T4? The answer is arch of aorta. Okay, because arch of aorta is started at T4 and end at T4. So this will be found at the T4 level. Azygos vein nearly about T5. Okay, brachiocephalic will arise from the arch of aorta, so they will not be at T4. And left subclavian will also be in the upper part, so they will not also be from the T4. So in T4 we will mainly find the thoracic arch of aorta. Next is what is the uppermost structure found in the left lung hilum? For the lung hilum structure, you need to remember the Atal Bihari Vajpayee on the both side. Okay, but on the right side you need to add E. E Atal Bihari Vajpayee and Atal Bihari Vajpayee. What does it mean? A for artery. Which artery? Pulmonary artery. V for bronchus. Okay, and V for pulmonary vein. Which pulmonary vein? The inferior one. Okay, so this is the order structures are present. So same here, pulmonary artery, bronchus, and inferior pulmonary vein. Okay, and E means here the bronchus is divided into eparterial bronchus and hyparterial. On the right side, bronchus is divided into two. So eparterial will be the uppermost on the right side. On the left side, uppermost will be the pulmonary artery. So here they are asking about the left lung, so answer will be pulmonary artery. Next is, which of the following is not a tributary of cavernous sinus? So this has some controversy because these two are the draining sinuses. Okay, so means they will drain the cavernous sinus into the transverse and sigmoid sinus. But since they have direct connection to cavernous sinus, so these three will be the true. The last one first will drain into spinoparietal, then it will drain into the cavernous sinus. So the answer will be the last option, that is deep middle cerebral vein. The next is central area of face is dangerous area because it has direct connection with the cavernous sinus. So any infection can go to the cavernous sinus and lead to the cavernous sinus thrombosis. Next is superior cerebral veins are draining into. These will drain into the superior sagittal sinus. So here you can see these are all our superior cerebral veins. They will drain into superior sagittal sinus. Next is parathyroid glands are supplied by which artery? So common carotid, no supply to thyroid gland. Okay. Superior thyroid will supply to upper part of thyroid gland. Okay. Middle thyroid artery, we don't have such branch. Superior thyroid will come from external carotid artery. Inferior thyroid will supply the lower part of the gland and also the parathyroid gland. And this is the branch of thyrocervical trunk, which is the branch of subclavian artery. Okay, so the answer will be inferior thyroid artery. Infrahyoid driven muscles are contained in. So here you can see we have triangle. This area is our submental triangle below the mental or below the chin. These two are our digastric triangle or submandibular triangle. Digastric because they are present between the two bellies of digastric muscle. Then this is our hyoid bone. Below the hyoid bone, we are having muscles. These are strap muscle or ribbon muscle. So this is our muscular triangle. Then this area between the posterior belly of digastric and inferior belly of homohyoid, posteriorly by the sternocleidomastoid, this is carotid triangle, which is having carotid arteries. Okay, so this area is having our all strap muscles. So answer will be muscular triangle. Next is superficial incision. Okay, next is superficial incision in posterior triangle of neck leads to. Okay, so if you know that in superficial area, or I can say just below the skin and superficial fascia, we are having spinal accessory nerve or the 11th cranial nerve. Okay, this nerve will supply two muscles, sternocleidomastoid and trapezius. Okay, so while coming out from the jugular foramen, it will first supply the sternocleidomastoid muscle. Then it will passes posteriorly into the superior part of the posterior triangle and supplying the trapezius. So the injury is occurring in this area. So means the sternocleidomastoid will be the normal, only trapezius symptom will occur. So that is shrugging of the shoulder. Okay. Other than this, if you have remember, we have few other muscles in our arm which will cause other problem like start of abduction will be one second. Okay, so start of abduction is mainly by the supraspinatus muscle. Okay, so for the abduction, you need to remember few things. 0 to 15 degrees Celsius, 15 degree will be by the supraspinatus. Okay, next 15 degree to 90 degree abduction while the deltoid muscle. Okay, and more than 90 degree by the trapezius and serratus anterior. Okay, so if they have any problem in difficulty in static abduction, then the problem with the supraspinatus. Difficulty in rotation of face towards the same side, this will be the problem in the sternocleidomastoid muscle. So here it will not have any problem because it is normal, only injury occurring in posterior triangle. So sternocleidomastoid is functioning normally. Problem with flexion means rhomboides major and minor are having problems. So Here the answer will be A, difficulty in shrugging the shoulder. Next is branchial sinus passes between, so that direct answer is between the two carotids. That's why during the branchial sinus surgery, we need to take care of our carotids. Okay. Next is 8-year-old boy come to the physician by the mother complaining of fever, sore throat, 5 days, vital is stable. He is having lymphadenopathy. On examination, gray mucous membrane over the right tonsil. Okay. What is media we can use for the earlier diagnosis? Okay. So whenever you will read any gray mucous membrane over the tonsil, this is a pseudomembrane. Okay, pseudomembrane in the Corynebacterium diphtheria or diphtheria. Okay, so this is the answer for diphtheria, also called as loeffler bacillus. So the answer will be loeffler serum slope. Okay, so for the diphtheria, you need to remember that you will see lymphadenopathy. So you can see in this girl, all the cervical lymph nodes are enlarged. So this is bull's neck. Okay, here you can see this membrane over the tonsil. Okay, so this is our pseudo membrane over the tonsil. If we will try to remove this, patient will have, in this area we will see small dotted bleeding or petechial hemorrhage. And if we will stain this by the alpha stain, we can see this Chinese letter appearance. Okay, Chinese letter appearance. In this green area is our bacillus, and that purple area, this purple area is the metachromatic granule of the diphtheria. Okay, so alba stain, this is our bacilli, or this is our Corynebacterium diphtheria, and this is the metachromatic or volutin granule. These are containing phosphatase for their survival during the adverse time. Blood agar we are mainly using to differentiate between the Streptococcus species, Algae media for the TB, nutrient agar we can use for any other. Okay. Next question is 48-year-old female having hard lump in the upper neck, draining sinus with granules, discharge, aerobic, non-acid bacilli. Whenever you are having any draining sinuses, okay, so draining sinuses with granules, this is mainly the mycetoma. This condition is called as mycetoma. Okay, this mycetoma can be of two types. Cause if bacterial, this is actinomycetoma. Okay, if the cause is fungi, then this is eumycetoma. Okay, so the answer here will be actinomycetes. Why? Because actinomycetes is saying no, means I am not acid fast. So this is not a acid fast bacteria, nor this is a aerobic. So this is anaerobic. So anaerobic non-acid fast is actinomycetes. This is causing actinomycetoma in the jaw of the patient. Tuberculosis is acid fast. Listeria is having tumbling motility. Nocardia is also very less acid fast. So this is also acid fast, and this is also anaerobe. Nocardia is aerobe. Okay. 59, 25-year-old man, pool sorter. Okay. Shortness of breath, fever, chills, 4 days. Culture on penicillin agar, you will find string of pearl appearance. What is the diagnosis? Okay. So whenever you will read any wool sorter, okay, then they are also giving one more hint, penicillin agar, you will have string of pearl appearance. Then the answer will be bacillus anthracis. Okay, so bacillus can be affected by this directly come from the like contact route or skin contact, from the inhalation route, or from the ingestion also. So here it will be from the bull shorter, means those are carrying the working in the bull area. So the most common route will be inhalation. When they are carrying the dead animal's skin, then that will be the skin contact. In that case, you will find malignant scar. So here you will find the bacillus anthracis. So for the anthracis or bacillus anthracis, you need to remember when you are trying to stain them on gram stain, okay, in the center they are having spore. So spore will be blank in the gram stain in the empty area. Rest of the area will be pink because they are gram positive, pink or purple. So it looks like bamboo appearance, okay, or box in a car appearance. Okay, so in gram stain you will see bamboo appearance or box in a car appearance. Okay, and if you will grow them on the blood agar, okay, if you will try to grow them on the blood agar, okay, so in blood agar they will show multiple morphology, like this is frosted glass appearance, here you can see this is comet tail appearance, here you can see this is beaten egg appearance. Okay, when you will zoom on these peripheral areas you will find this medusa head appearance. Okay, but when you will grow them on the penicillin agar, okay, they will show you this string of pearl appearance. So this is bacillus anthracis. Other than this, you can remember all of other those tests, and this is a category A drug, category A microorganism. Last question for today is 33-year-old male, orthopedic department after road traffic accident 3 days before. On third day, develop fever, swelling, bone pain, and tenderness. What is the most common cause or phage strain? So the most common organism here will be Staph aureus. Okay. For Staph aureus, you need to remember two phase. One will be responsible for the outbreak in the hospital. So that is 81 upon 81A. Other one will be for the MRSA. Okay, formation of MRSA, that will be third strain. So here answer will be 80 upon 81A. And here we have finished almost, we have finished all our 60 questions of this scholarship test 1. And thank you so much for your attention. And if you have any doubt, you can write it in the comment. I will see, and you will. Thank you so much for the subscribe, and thank you so much for your attention. And also please like, share, and subscribe our Oats Pathshala channel. Sooner you will have the next test on the 15th of January, 15th of June for not June, 15th of April for pathology and pharmacology. So for that also you will have discussion, you will find discussion on the YouTube channel, and you will also have Zoom discussion during that time. Okay, thank you so much.